I'd like to welcome you to the Visceral Osteopathy series, treating the upper gastrointestinal tract, meaning the esophagus. Now, a lot of things can go wrong within those areas because, as we know, things like acid reflux are often caused by problems, like I say, within the plumbing of the upper GI tract, the beginnings of the whole system. And we see this type of phenomenon in women who are pregnant because the weight of the baby is pushing up the upper organs. And we can also see spasms within the esophagus itself. And you'll see that when we come to discussing how the esophagus actually is positioned within the body and its purpose and its way of functioning, we can understand that if there is a certain degree of hypertonicity, too much stress or tension within the chest cavity, the esophagus can end up being in a state of spasm, and therefore the food has difficulty going down. So we're going to be, first of all, assessing for any dysfunction within the esophagus, within the structures surrounding the esophagus, which is within the thoracic cavity. That'll go a long way towards not just allowing the food to be able to transverse through the diaphragm and dump down into the stomach, but also in relieving a lot of intrathoracic pressure. We know if a person is stuck in inhalation, what's happening is everything is getting pulled upward. There is a difference in the pressure gradient between the chest cavity and the stomach cavity, and that in itself can also cause abnormal tension or tone on the esophagus. So you're starting to see how it's all interrelated. Now, in our demonstration videos, I'm going to show you how to test for and treat the esophagus, what you're going to look and feel for within the fascia in that area, within intrathoracic cavity pressure, and then to go about treating and releasing restrictions in that area. And we're going to learn how to do that in a prone position and also in a seated position. You have different tools in your toolbox that you can reach for depending on what's appropriate and comfortable for you and for your patient at the time. So that gives you an overview of what our goal is. Let's move on, let's move forward, and let's take a look.